Which organization developed the first hospital standardization program? A. Joint Commission. B. American Osteopathic Association. C. American College of Surgeons. D. American Association of Medical Colleges. When correcting erroneous information in a health record, which of the following is not appropriate? A. Print error above the entry. B. Enter the correction in chronological sequence. C. Add the reason for the change. D. Use black pen to obliterate the entry. Who is responsible for writing and signing discharge summaries and discharge instructions? A. Attending physician. B. Head nurse. C. Primary physician. D. Admitting nurse. Dr. Jones has signed a statement that all of her dictated reports should be automatically considered approved and signed unless she makes correction within 72 hours of dictating. This is called A. Auto-authentication. B. Electronic signature. C. Automatic record completion. Which of the following is not an accepted accrediting body for behavioral healthcare organizations? A. American Psychological Association. B. Joint Commission. C. Commission on Accreditation of Rehabilitation Facilities. D. National Committee for Quality Assurance. What type of standard establishes methods for creating unique designations for individual patients, healthcare professionals, healthcare provider organizations, and healthcare vendors and suppliers? A. Vocabulary standard. B. Identifier standard. C. Structure and content standard. What type of organization works under contract with the CMS to conduct Medicare and Medicaid certification surveys for hospitals? A. Accreditation organizations. B. Certification organizations. C. State licensure agencies. D. Conditions of participation agencies. Which of the following specialized patient assessment tools must be used to Medicare-certified home care providers? A. Patient assessment instrument. B. Minimum data set for long-term care. C. Resident assessment protocol. D. Outcomes and assessment information set. Identify the correct ICD-9-CM diagnosis code for a patient with an elevated prostate-specific antigen, PSA, test result. A. 796.4. B. 790.6. C. 792.9. D. 790.93. A 22-year-old patient presents for a closure of a patent ductus arteriosus. The patient's thorax is open posteriorly and the vagus nerve is isolated away. The PDA is divided and sutured individually in the aorta and pulmonary artery. How is this procedure coded? A. 33,813. B. 33,820. C. 33,824. Identify the correct ICD-9-CM diagnosis code for a patient with anterolateral wall myocardial infarction, initial episode. A. 410.11. B. 410.01. C. 410.02. D. 410.12. Select the option that is related to the third term in the same way as the second term is related to the first term. Ivory, ZWSPJ cream? A. SNFDB. B. DSFCN. C. BQDZL. Select the option that is related to the third number in the same way as the second number is related to the first number. 223, 350, 519? A. 736. B. 687. C. 654. D. 645. A hospital is planning on allowing coding professionals to work at home. The hospital is in the process of identifying strategies to minimize the security risks associated with this practice. Which of the following would be best to ensure that data breaches are minimized when the home computer is unattended? A. Username and password. B. Automatic session terminations. Identify the correct ICD-9-CM diagnosis code for a patient with an elevated prostate-specific antigen, PSA, test result. A. 796.4. B. 790.6. C. 792.9. D. 790.93. What type of organization works under contract with the CMS to conduct Medicare and Medicaid certification surveys for hospitals? A. Accreditation organizations. B. Certification organizations. C. State licensure agencies. D. Conditions of participation agencies. The blood disorder in which red blood cells lack of the normal ability to produce hemoglobin is called A. Aplastic anemia. B. Hemolytic anemia. C. Pernicious anemia. D. Thalassemia. In the CPT coding system, when there is no code to properly represent the work performed by the provider, the coder must use this code. A. Not otherwise specified. B. Not elsewhere classifiable. C. Unlisted procedure. D. Miscellaneous code. They are the organizations that contract with Medicare to perform reviews of medical records with the corresponding Medicare claim to detect and correct improper payments. A. Atlas System. B. Medical Outcomes Study. C. Recovery Audit Contractors, RACs. A marked loss of bone density and increase in bone porosity is A. Lumbago. B. Osteoarthritis. C. Spondylitis. D. Osteoporosis. CMS delegates its daily operations of the Medicare and Medicaid programs to A. The Office of Inspector General. B. The PRO in each state. C. The National Center for Vital and Health Statistics. D. Medicare Administrative Contractor, MAC. What is the term used to describe the adjusting of the dollar amount due from the patient or insurance company to reflect a zero balance due on the claim? A. Authorization. B. Write-off. C. Rebill. D. Outstanding. The APC, Ambulatory Payment Classification, payment is based on what coding systems? A. AMA's CPT codes. B. CPT and ICD-9-CM diagnosis and procedure codes. C. ICD-9-CM diagnosis and procedure codes. D. CPT-HCPCS codes. When a patient is admitted because of a primary neoplasm with metastasis and treatment is directed toward the secondary neoplasm only. A. Code only the primary neoplasm as the principal diagnosis. B. The secondary diagnosis is coded as the principal diagnosis and the primary neoplasm is coded as an additional diagnosis. C. None of these. Which of the following is coded as an adverse effect in ICD-9-CM? A. Tinnitus due to allergic reaction after administration of ear drops. B. Mental retardation due to intracranial abscess. C. Rejection of transplanted kidney. D. Non-functioning pacemaker due to defective soldering. If any part of a combination code was not present on admission, POA, assign the POA indicator of A. Y. B. U. C. W. D. N. The practice of using a code that results in a higher payment to the provider than the code that more accurately reflects the service provided is known as A. Unbundling. B. Upcoding. C. Optimizing. D. Downcoding. The patient sees a PAR provider and has a procedure performed after meeting the annual deductible. If the Medicare-approved amount is $200, how much is the patient's out-of-pocket expense? A. $0. B. $20. C. $40. Patient, inpatient, was admitted with chest pain. Doctor ordered EKG to rule out MI. A. A code for a myocardial infarction. B. A code for the patient's symptoms. C. A code for an impending myocardial infarction. D. No code for this condition. Which of the following could influence a facility's case mix? A. Changes in DRG weights. B. Changes in the services offered by a facility. C. Accuracy of coding. D. All of the above. According to CPT, a biopsy of the breast that involves removal of only a portion of the lesion for pathologic examination is A. Percutaneous. B. Incisional. C. Excisional. D. Punch. Documentation regarding a patient's marital status, dietary, sleep, and exercise patterns, use of coffee, tobacco, alcohol, and other drugs may be found in the A. physical examination record. B. History record. C. Operative report. Which of the following would not be found in a medical history? A. Chief complaint. B. Vital signs. C. Present illness. D. Review of systems. Which of the following documentation must be included in a patient's medical record prior to performing a surgical procedure? A. Consent for operative procedure, anesthesia report, surgical report. B. Consent for operative procedure, history, physical examination. C. History, physical examination, anesthesia report. Which of the following reports include names of the surgeon and assistants, date, duration, and description of the procedure and any specimens removed? A. Operative report. B. Anesthesia report. C. Pathology report. D. Laboratory report. The clinical statement, microscopic sections of the gallbladder reveals a surface lined by tall columnar cells of uniform size and shape would be documented on which medical record form? A. Operative report. B. Pathology report. C. Discharge summary. Both HEDIS and the Joint Commission's ORYX program are designed to collect data to be used for A. Performance improvement programs. B. Billing and claims data processing. C. Developing hospital discharge abstracting systems. D. Developing individual care plans for residents. What is abstracting? A. Compiling the pertinent information from the medical record based on predetermined data sets. B. Assigning the appropriate code or nomenclature term for categorization. C. Assembling a chronological set of data for an express purpose. What type of standard establishes uniform definitions for clinical terms? A. Identifier standard. B. Vocabulary standard. C. Transaction and messaging standard. D. Structure and content standard. According to ICD-9-CM, an elderly prima gravida is defined as a woman who gives birth to her first child at the age of or older. A. 30. B. 35. C. 38. D. 40. ICD-9-CM defines the newborn period as birth through the day following birth. A. 28th. B. 14th. C. 60th. D. 30th. Late pregnancy, category code 645, is used to demonstrate that a woman is over A. 41. B. 39. C. 40. D. 42. Which of the following would be classified to an ICD-9-CM category for bacterial diseases? A. Herpes simplex. B. Staphylococcus aureus. C. Influenza, types A and B. D. Candida albicans. Which of the following would be classified to an ICD-9-CM category for bacterial diseases? A. Herpes simplex. B. Staphylococcus aureus. C. Influenza, types A and B. D. Candida albicans. The coder notes that the physician has prescribed Retrovir for the patient. The coder might find which of the following on the patient's discharge summary? A. Otitis media. B. AIDS. C. Toxic shock syndrome. D. Bacteremia. What diagnosis would the coder expect to see when a patient with pneumonia, PNA, has inhaled food, liquid, or oil? A. Lobar pneumonia. B. Pneumocystitis carinii pneumonia. C. Interstitial pneumonia. D. Aspiration pneumonia. Where would a coder who needed to locate the histology of a tissue sample most likely find this information? A. Pathology report. B. Progress notes. C. Nurse's notes. D. Operative report.